I was considered crazy by my colleagues. I mean, here, by all accounts, I was at a huge hospital system, salaried, all these great, seemingly desirable parts. And I just knew that for me, I felt like my soul was at stake.
Hey, Dr. Rubal, thanks for joining the podcast.
Oh, thank you so much for having me. I'm excited to be here.
So your name precedes you. We have a lot of mutual friends who talk about what an amazing doctor you are. Mm. And you are a rare breed, which is a very important one because you work in the fertility awareness space and fertility support space, but you do it in a really holistic and amazing way. So I'm excited to get into it and to get into some of your past experience because I know you've had your own journey. Mm-hmm. So starting out, tell me a little bit about where you're from and your background.
Oh, absolutely. So I am born and bred in Florida. I did all my schooling there, went to University of Miami, both for undergrad and my medical school, and then came out to USC and Los Angeles for residency in OBGYN, and then stayed on after that 4-year residency for a 3-year fellowship in reproductive endocrinology and infertility.
And did you always, growing up, think you would be a doctor, or where did the desire to even go to med school come from?
I think this is a common thread for many physicians. Yes, from the time I can remember, I wanted to be a doctor. I wanted to help people. I actually, until the end of medical school, I wanted to be a pediatrician. Aww. And then I was on my pediatrics rotation, and unfortunately, I realized how much I loved communicating with my patients and really being able to share their journey. And so it wasn't for me in some parts of pediatrics, and then really fell in love with OBGYN and being present at birth and walking with women throughout the course of their lives, really. And so decided to go into that field.
And what was your upbringing like before we go into your practice?
I had a lovely upbringing. I'm stereotypically oldest of 4. And so my mom is a nurse who actually immigrated from the Philippines in her 20s. She was very brave, didn't know anyone in the States, but came over because there was a need for nurses, and met my father in Sarasota, Florida. And so we lived again in Sarasota, which is on the Gulf Coast of Florida, for my whole life until I left to med school. But it was a really lovely upbringing that was rooted very much in the desire to be successful. And I would say that would be not only academically or maybe of the world, but also to really try to be close to God. So my family's Catholic. So I was a cradle Catholic and was really surrounded by a lot of those influences because my aunts were there. And, Filipinos are very devout in their faith. But unfortunately, I feel like I knew the how, but perhaps not the why. I feel like I wasn't very well catechized. And that does lead to parts of my journey later on for myself personally.
Okay, so you're finishing up med school and you're choosing tell me about your specialty and how you chose it.
Oh yeah, I mean, I love the sisterhood. I love being with my patients. I really enjoyed OBGYN is a huge mix. And so for someone like me, I never have the same day twice. I'm doing lots of different procedures. I'm having continuity of care. I get to know my patients really well, but I also get to be using my hands. I discovered how much I loved surgery. Who knew? I was not anticipating that. But for all those reasons, I just felt like OBGYN was the field that would, that is my vocation, actually. Mm-hmm.
What do you mean by that, your vocation? For those listening, I mean, that term, I think different folks mean different things by it. What do you mean by it when you say that?
My calling. I think my way to really fulfill myself, but hopefully fulfill others. Like I said, to be able to, it's such a special gift to be able to be with people in their suffering, to walk alongside them, hopefully to provide peace and perhaps hope is obviously the ultimate goal. It's amazing. So that's what I mean by it.
I love that. All right. So tell me about your first time practicing outside, when you're done with your residency and done with your fellowship, your first job. Yes. Although those were jobs too. I know a little bit about it. I know it's like you study for a million years and then you work more. So.
Right, yeah. Well, residency and fellowship were definitely their own beast. You're working 80 hours a week in a hospital, and there's a lot of hierarchy and lots of learning happening still. So, but yes, its own place. And so going out and being an attending, which means that you are it. There is no, you of course have colleagues you can talk to, but you are the end all be all in making decisions together with your patients, right? And so I came down to Orange County at that point. I was working in a large healthcare system. And, it was a wonderful system in some ways. I think they do a great job supporting the physicians so that they can practice medicine and don't have to worry about maybe the administrative parts of medicine that a lot of us aren't drawn to quite as much. But I also think for me personally, experiencing and again, being that one ultimately making those decisions in conjunction with my patients was difficult, was more difficult than I had realized in my training. And I say that because the field of reproductive endocrinology has many moral and ethical issues. And, as a result, it's something that I'm dealing with or was dealing with certainly on a daily basis with people.
So what sorts of things were you facing? I mean, there's the whole world of reproductive technologies, there's birth control, there's all of these issues that I want to get into and your experience with it and your positions on it.
Mm-hmm. Well, yes, all of the above, right? I know, listen, again, there's so much suffering that can happen when especially for fertility, for example, itself. So I would see patients with fertility, I would see patients with multiple miscarriages. I would see women who also had abnormal cycles, be it irregular or heavy or painful, okay? And in all of those circumstances, I really believe in some ways I was offering a very biased approach, quite frankly. Since then, I've completed my integrative medicine fellowship, and I feel so much more armed to give women a range of options that are scientific and evidence-based, but also natural and just an alternative. And so I say that because when I was practicing before, especially for fertility patients, again, they're consumed understandably by this desire and this fear for children, fear that they may never have a child and a desire to become parents. And those are all completely understandable and causes and sentiments. But with that being said, I think that what is very difficult is that just because medicine can do something doesn't necessarily mean that we should. And in some ways, I believe we as physicians have inserted ourselves into a very mysterious and beautiful act and creation of a child. And it's a slippery slope because once we start doing that, where does it end? Okay, and there's a dark side to this that I think can occur.
So tell me more about that. So were you working actually in a place where they were doing IVF? Was that part of the focuses of the system you were working in? And then what was that like? And you mentioned there's a dark side to it. Tell me more about that.
Right. Yeah, I was doing IVF and was working at a center that performed in vitro fertilization, which is essentially where a woman is given medications to stimulate her ovaries to produce more than one mature eggs. And then there's a process called an egg retrieval where those eggs are removed from the body through a needle that's placed through the vagina and watched under ultrasound guidance. And then outside of the body, the mature eggs are combined with sperm, and the embryos that result are watched over a period of days. And then a certain amount of them may be biopsied to be screened for certain issues or chromosomal screening, and or transferred back into that woman's or another woman's uterus. And so that's the process of IVF in general. And so, yes, I was doing it all the time. And I would say that my experience with it, again, I think that I it wasn't all negative. It wasn't all dark. There was a lot of joy in when people were able to get pregnant, and they were, again, that was beautiful in that sense, to be able to what I thought help, right, in that way. But I would say in terms of the dark side is that, oh my goodness, again, there are multiple things. I think that for me, it's that for some reason, we've all put it into our minds that IVF is the perfect cure, that we're going to have 100% chance of success. And we aren't in control, ultimately, number one. Number two, it isn't perfect. Again, just like anything else, there are pros with everything and there are cons. And those cons can be short-term risks, but they can be long-term issues for the mom, let alone the possibility that for babies, we do know that there might be an increase in risk of things like birth defects in babies born after IVF and ICSI, which is a way to place sperm into an egg, for example, and which is a slight absolute risk, but a risk nonetheless. We know that there's a lot of data coming out now looking at this incidence of donor half siblings, and 50, tens to 20s of donor siblings that might be meeting now and falling in love. And what does that kind of ramification look like as we move forward with more and more of this technology being used, right?
So in that case, there's a sperm donor, and then that man, his sperm is all these different places in terms of which eggs, it's turning into embryos with. And then there's different adoptive families, or there's not adoptive, but families that are maybe asking for the sperm donation. And you're saying in some cases, they're actually later on growing up and then finding each other, these children, once they're adults, and falling in love and not realizing that they're biological siblings.
Absolutely. I think it was an article in the LA Times, I think it was actually, that discussed this one specific donor, and there were 50 plus of his biological offspring that were in potentially close proximity to each other. And then again, discussing what does this mean in even, 30 years when there might be even more. And so there's really a lack of some regulation, I think, in some parts. And that just is, again, one piece of it, okay? There's the adoption of new technologies, which, again, the progress and scientific progress is not a bad thing. But sometimes we don't understand the long-term ramifications, and this goes even for embryo screening and making these decisions on whether you're going to transfer that embryo back or not. And I remember being in that chair sitting, and there's a couple has one embryo. And we tested it, and it was screened as what's called aneuploid, or abnormal.
How so? Do they know what does that mean?
It means that the chromosomes are not a normal number. The normal 46 chromosomes that are considered normal.
So what kind of condition might that child have?
And so that does include things like Down syndrome, which is 3 copies of chromosome 21. There are other types, so you can have one less chromosome than you should, or multiple or complex abnormalities. Again, and then to tell this couple and to have to make that decision with them that a transfer would not be done because of that is heartbreaking.
What does that mean, the transfer won't be done?
That because the embryo was, again, screened, it's not a diagnostic test, it's a screening test, was screened as abnormal, that the embryo would not be placed into that woman's uterus.
So what would happen to that embryo?
The embryo would then be destroyed.
How often would that happen? How often were embryos being destroyed after screenings, or maybe just not selected for other reasons?
I'm not sure of the actual number, to be frank. I can't quite recall. So I don't know, but I will say it's not uncommon. I mean, absolutely. And we know that there are about 1 million embryos frozen in the US currently. And again, these embryos might be excess, meaning that the couple's already done IVF and they have additional embryos that are in cryopreservation, which is just a fancy way of saying freezing and storage, okay? And it's not clear if those couples will ever have another child or try again. Or in the cases, I think, again, there was that one case with a celebrity, how they had gotten divorced, and then who was going to retain possession, right, of these embryos and what they were going to do with it. I think I recall something like that happening. That is not, that happens. And so you think about the fact that this embryo, I mean, again, I feel as an OBGYN and as in my early practice, I felt so blinded in some ways. And that was my own ignorance, I think, and lack of catechesis, which I mentioned earlier, for myself because of my faith. But I also think it's, again, the bias that's inherent in our current medical system, quite frankly, that they actually changed. Conception occurs and a new life begins when the egg meets the sperm. And that happens in the tube, actually, within 24 hours after the egg is released. And then that embryo divides on its own from that point. And the embryo will divide in a dish on its own if you give it, of course, proper nutrition in the environment, but will completely start to divide its cells. It goes from a couple cells to hundreds to millions within the course of days. And that's life. And so it's so interesting because they change that concept of life from conception to implantation, which occurs about 5 days after the embryo is formed in the tube and when it enters the uterus and attaches to the wall of the uterus. And so again, it's very interesting, the semantics and how important words are in some ways, because it matters. It matters, and I felt so confused by that, or I didn't realize that in some ways.
So the medical system, and you're right, they've changed it from conception, fertilization to implantation, like you're describing. And so in an in vitro fertilization, an IVF clinic, they're not even considering this a human life because it's not, he or she has not been implanted yet. So what is for frozen embryos, what happens to the million? Were there embryos frozen at your clinic, and what would happen to them?
Well, they'd stay in storage indefinitely. But I think, again, it raises all of this ripple effect and the downstream issues that can arise from this. So certainly there's supposed to be a process where they're in storage afterwards. However, that storage costs money. And so the couple would then have to pay an annual fee to continue to keep those embryos stored. But the other dimension of this is, what if that couple, you stop hearing from them, they move, something happens, and now here you have these embryos, what to do with them? And I think the default that most clinics do these days is that they just continue to keep them in storage and try to, track down the couple. But yes, I think it raises a great point, is they could be there forever. Okay.
And then the couple could just request destruction of the embryos at any point.
Yes.
And there's not are there questions asked at that point?
No, there's just you have to draft a legal document because embryos are considered, again, property.
Property.
Right.
It's crazy. Literally, human beings are property, considered property. So tell me about, so you're doing this work in IVF, or you're also doing other forms of gynecology work with patients?
Yes, yeah. I was still operating. I was doing lots of hysteroscopies, which is a way of looking inside the uterus. Love doing those. I was still treating women who have hormone imbalances, again, for abnormal cycles, taking care of doing general GYN in a smaller scale. Certainly seeing lots of women with recurrent miscarriage. Yeah.
So at some point you decide to leave and start your own clinic. Tell me about that decision process, that decision-making that you went through.
Again, for me, it was a long time coming, but I also feel like, I told you, I love what I do. I feel so blessed to be able to participate in people's lives the way I do, as I already shared. And I started just dreading going to work in the morning. And every day I would wake up and I just really have this weight on me because, like I told you, I was having to counsel patients. It's a very, when you realize finally that, again, this embryo is a life. And what are why am I in charge of this? And why, again, I felt like we were starting to treat embryos as a commodity. I felt just not wanting to be involved in it. And so as a result, I think it really, for me, it was my conscience, and it was the Holy Spirit for me, telling me and really to examine my life, what I was doing and what my goal was ultimately, and where my ultimate, where I wanted to be, both in this life and the next. And as a result, I knew that I had to change. And I have the world's best husband who's incredibly supportive, because I was considered crazy by my colleagues. I mean, here, by all accounts, I was at a huge hospital system, salaried, on my way, had to wait maybe a year more to get a pension, healthcare benefits, all these worldly things. Not having to worry about admin, all these great, seemingly desirable parts. And I just knew that for me, I felt like my soul was at stake. And I also wanted to help women who wanted alternatives, because I think that there are alternatives that are more natural, that are more holistic, that are going to change women's lives and improve their longevity overall, as well as their baseline health, instead of all these Band-Aids we keep offering to women, both in the form, for me, I think, of contraceptives or synthetic hormones, as well as these more aggressive procedures.
So how many years, when you had this turning point moment, how many years had you been practicing up until that point?
I'd already been practicing for 6-7 years at that point.
And so you're at this moment of, I want to leave, or I want to do something different, do practice differently. You don't want to leave medicine. You love what you do. Yeah. What did you do next? So again, talked a lot with my husband about it, and also again, I was really, prior to that, I was really finding my faith, I think, and so also talked to a priest and had a wonderful conversation. He was very instrumental in helping me actually see the truth and also have the courage to make the right decision for myself. And I just did it. You just have to kind of do things sometimes. And so I just left. And did you have another job lined up?
No, I created my own practice. And so
you just quit and you're like, I'm going out on my own.
Yep. I'm hanging my own shingle. That's right. And so I opened my own practice, which is really, again, dedicated to a restorative approach to reproduction. And it's been a wonderful journey, because it's so funny, actually. Right before I left, or right after I left, it was the beginning of 2020, and I've got 3 little ones, and then the pandemic hit, and I had to be a homeschool teacher at that point, and there was no way I was working full time before. There was just no way I would have been able to juggle it all. So I really feel like it was providential, everything that occurred. And I felt like I was really, God really took care of it all, and once I surrendered to him and really followed the truth.
It's amazing. I feel like I was just talking with another woman recently who was sharing about what a blessing in disguise the pandemic was, but truly how God works out all things when you take the leap of faith, which you did. So you are basically homeschooling during the pandemic. You've got 3 little ones. And then what tell me about emerging from that and starting your practice.
Yes. And tell
me more about your passion for holistic care for women, because I think it's so needed today. It's so needed. I know a lot of people listening, maybe they're seeking it themselves, or they've had friends who've gone through infertility or have been on birth control, and they're like, this is just not working, and there's so much trouble with it, even as separate from the ethical considerations, which I want to hear your thoughts more on, but also just the real ramifications for women physically and emotionally, and the psychological health, the mental, the ill effects mentally that it can have on women, birth control. So talk to me about what the alternatives are.
Absolutely. Well, I have to say, I think that the Integrative Medicine Fellowship was life-changing. It was wonderful. It felt like medical school all over again. I didn't feel like I had heard any of it in medical school. I'm sure I did, and it was my recollection. But we get maybe a couple of weeks on nutrition, for example, whereas this is a 2-year fellowship that's really dedicated to the importance of mind-body medicine, of, again, lifestyle choices, food as medicine, exercise and its importance, different nutraceuticals and botanicals, environmental toxins and their impact. And so I think, and there is data showing that all these things impact women, well, all of us, but women and our fertility potentially, our onset to menopause. There's an interesting study kind of correlating quartiles of bisphenol A, which is a type of plastic that I feel like everyone may have knows about, and urinary levels showing our higher exposure of this is associated with entering menopause a couple of years earlier, actually even. And so that's just one example showing that these are controllable factors in some ways in our lives that we can optimize and feel better, and also hopefully normalize our cycles and not have to rely upon some of those Band-Aids like I was talking about, because you're right, they have ill effects.
So the study you just mentioned, plastic ultimately is leading to women going through entering menopause earlier.
It's a
kind of plastic.
It's not that. So that wasn't the type of study that was done. You have to have a different type of study. This is an association, and so we can't say it's necessarily causative.
I see.
But the fact that on this large scale study there was an association that was seen between these higher levels as well as a younger age at menopause is compelling, and it deserves further study. Yeah. Mm-hmm.
Yeah, there's a lot of, I think, people out there who are looking at their environment, and there's a lot of talk about toxins, and but there's also just a lot of it seems inconclusive. We're not really sure exactly. There's a lot of correlation, and we're not sure is it actually causing this thing, but we do know that there's health issues that women are having. Lots of different kinds of health issues, and so people are scrambling looking for answers. So what does holistic health look like for women, especially when it comes to women facing infertility?
Well, I'll tell you just from my personal experience, it's so interesting. I think that there are so many, we're faced with an onslaught of, like you said, different potential toxins, a different environment, a much more fast-paced life that's going to affect us mentally, and social media, which has its own layers, as well as I've found a lot of hormone imbalances. And so the amount of women who are dealing with, for example, something called hypothalamic insufficiency, which is a fancy way of saying that the gonadotropins, which are hormones that come from our brain and talk to our ovaries and eventually cause ovulation to occur. They cause the release of the hormones estrogen and progesterone, which help support our bodies and also help support a pregnancy, for example. With hypothalamic insufficiency, those hormones, because of stress in some ways, be it emotional or physical or nutritional stressors, they might become lower, that they might not be released as readily. And as a result, you may not ovulate as quickly as you normally would. You may not produce as much progesterone to support a pregnancy as you normally would. And there are all these other hosts of effects. Again, for example, I feel like in my practice, a large number of patients have begun presenting with these issues. And I think that it's partly some of the stressors from 2020 and then 2021 and 2022 and all of this. Yeah. So that's one example, or the incidence of thyroid issues that I'm seeing, some of these other hormones. The nice thing is that, again, this can be mitigated and addressed by both a root cause approach. For example, what are these stressors for you? How can we build a plan to help recenter yourself in daily life, as well as different botanicals? And so you can really use both to try to heal this woman. And the same goes for something like polycystic ovary syndrome, which is an imbalance of male and female hormones. And so it's exciting working with women and seeing them improve. It's just wonderful. And not having to rely upon, again, birth control pills, for example, to try to just mask their symptoms.
So the difference in your previous practice, when a client would come in, a patient would come in, and they had like let's say a hormone imbalance, and so they were having trouble becoming pregnant, as an example, or that repeat miscarriages. Would you do that same analysis in your previous practice to understand those imbalances, and would there be an attempt to treat them, or would there be, how are the treatment plans different in what you're doing today versus what you might have done in the past?
I mean, I think that a lot of them share, in terms of evaluation, a lot of it is similar. We're going to look at all of the reproductive hormones because those are areas that we can try to normalize and correct, okay? With that being said, I think I'm more complete and thorough now, and even within evaluation. And that's because, again, of this integrative medicine model that we are whole people. We're not just ovaries in a vacuum is kind of how I think about sometimes the way I used to treat people. And as a result, for example, with recurrent miscarriage, their microbiome matters. That's the good guy bacteria that protect us against the bad guys. And we have specific defense systems and these bacteria in all different parts of our body. And so I think everyone hears about the gut and how central it is, and importance for even immunity and mood and all of these other factors. The reproductive microbiome that exists, and there are studies correlating a normal complement of good guy bacteria with, again, association with optimized pregnancy outcomes. And so I'll focus on those parts of it as well, in addition to maybe the baseline hormone testing that I was doing more before, or kind of deepening that hormone testing. So that's the evaluation part. For the treatment part, certainly, unfortunately, I think so much in OBGYN, the answer, at least previously in my practice, was birth control pills. So pain with periods, acne, abnormal cycles, heavy bleeding. It was the same answer. And it's interesting because a woman's natural cycle is this beautiful cyclicity. And they're interesting studies because those hormones, estrogen and progesterone, they go into our brain. There are receptors for them in our brain, which accounts for all the mood issues that might occur, right? Certainly even within our own cycle, let alone with synthetic hormones, right? And instead of kind of nurturing and trying to normalize that beautiful cyclicity, birth control pills, what they do is they create a flat line. It's just an unceasing amount of low, essentially low estrogen and a low amount of progesterone that then is removed for a week, a month. And so you're fundamentally altering what we should be experiencing. And so it's no surprise there are side effects from this.
What are the side effects?
So there can be, the one I see, quite frankly, the most is mood issues. But there can be side effects like any hormone may increase the risk of blood clots on the blood vessels, unfortunately. And especially birth control pills. And the reason for that is it's ethinyl estradiol, which is a much more potent synthetic form of estrogen. And so as we take that and it gets metabolized through our liver, it can increase the production of clotting factors. And then that's the mechanism by which you can have an increase in risk. For example, there is a study that just came out quite recently showing that all forms of contraception, be it both combined with estrogen and progesterone or progesterone only, which many more women are using now, will slightly increase the risk of breast cancer. And so that was just published recently. There might be an increased risk. Again, the mood issue, there was a huge Denmark cohort study looking at almost 1 million women and showing that, unfortunately, from an age group of 15 up to, I believe, 30s, there is a statistically significant increase in the incidence of depression, which is double that in teens because their brains are so plastic. There's a lot of plasticity and neuronal connections developing, and this risk persists even after you stop it. And the same goes with suicidality. And when you think about this with the other pandemic that we're having right now, which is this teenage, really a mental health crisis for, I think, all ages. And in particular, we worry about it for the teens. I think it's quite concerning that so many of our girls are on contraceptives. I think they quoted that out of the 12 million teenage girls in the US, half of them are sexually active and another half of them are on birth control pills. And so that's That's an order of millions
It's
that might be
crazy.
affected. It's crazy.
Especially with that latest study that came out about 1/3 of teen girls. I don't know if it's as of 2021 or it's a recent year that they're getting the data from, but 1/3 of teen girls had suicidality, had suicidal thoughts. 1/3.
Yeah, so.
And you think about, okay, birth control and all of that impact on them. And then social media, I think, is another factor, and just the addictive nature, and it's proven to make your mood poor, increase your mental suffering. So that combination, I mean, you put them on birth control and you stick them in front of Instagram and TikTok for hours a day. I mean, that makes for a very sick teenage population.
Absolutely.
So what would be the solution for a teen girl? Do you see teen girls at your practice, and what's the solution for them?
I think this is the question, and I still feel like I'm trying to find I think I'm trying to find that solution, quite frankly. I think the solution for all of us is just having a solid foundation, being rooted well, again, in faith, in being in God, in our family, in ourselves. How do you do that, though, in a healthy way? Treat yourself, try to take care of yourself. How do you do that? I think that, again, that's when it comes into body, mind, soul, that you have to nurture. You have to try to take good care of your body. We know that all these, if there's one thing I tell my patients is, hey, try to decrease processed foods. It actually can matter. It increases inflammation, and this is all.
So what are examples of processed foods?
Oh, I mean, I would say that anything that will sit on a shelf for a long time and not go bad, for example, that isn't natural, anything that doesn't resemble its initial constituents, right? So that would be a lot of, even what I sometimes feed to my children because it's easy and it's convenient. Cereal. So yeah, breakfast cereal certainly, or fast food, right? Or chips, cookies, all of those things. And again, we start getting into this, and I always tell my patients that my number one goal is to decrease their stress, because it can be very easy to start feeling enslaved by a diet or enslaved by these restrictions. And that's not the goal. We have to give ourselves lots of grace. But small changes can have such profound impacts. Again, that study on the BPA, it was quartiles, right? And so it's not the absolute amount. We just can bring ourselves down from higher exposure to lower exposure. That can make all the difference with some of these outcomes.
I want to go back to the teen girls for a minute, because it's so important. They're the future, and how they're faring now can determine outcomes for a lifetime for them. And so you're seeing some teen girls, and you just mentioned the solution for teen girls. It's more than you can just do, right? I mean, you mentioned a strong foundation. It's about, what are they doing with the rest of their life, and the family that they're in, and the school, the friends they have. There's so much more there. What do you think? I mean, what should the medical system at least do when they're dealing with teenage patients? And not even patients who are sick and they're coming because something's wrong. But if you're a pediatrician, and so you're still seeing teen girls regularly, let's say, I've never had a teen daughter, and I don't remember being a teenager how often I go to the doctor, but there's regular check-ins, right? What should be the approach for teen girls?
Well, I think that we have to check in. I think that for everyone, it's good to have a purpose in life, and to really be looking forward and trying to see, how can I become a better person, but how can I also contribute to, this sounds a little cliche, but how to become the world becoming a better place. And so I think that really fostering that with all of us, and especially our teens, is so important, because it's a time when I remember feeling like you're very, I felt very self-absorbed, like it was just in very superficial concerns, and really reminding them that there is more to life than this. And then that's what they should be kind of striving towards, I think, is one big part that you can really check in with during the course of the visit. I think that supporting them, treating them as a mature individual who can do well, but also, I say that with a grain of salt, because they are still children, and they're still developing who they are and their thought processes and their logic. in some ways. And so also providing some guardrails. I don't think that they can make all the decisions and have, in some ways, that maturity to know 10 consequences down the road. And so we have to still be able to be those, I don't know if authority figures is the right word, but just people that love them and support them and want the best for them, but also can counsel them wisely. And so if we can do that as physicians, I think that would be really wonderful. And again, I mean, my bias, again, is always just to try to minimize the amount that we're going to be intervening with them in the sense of pharmaceuticals and whatnot. I really, again, and counsel them if we're going to be doing something. Wow.
Why do you think we're so over-medicated?
I think that medications in many ways it's so much easier to pop a pill than to have to make a foundational shift in what you're eating every day and stick to that. I know that feels harder for me. I mean, it is harder. It is. It takes 3 weeks to form a habit, and then it gets a little bit easier, but it is a process of change. And so I think that's one reason. And I think that personally, there are a lot of other vested interests that want us to be medicated, even though there are alternatives that ultimately are cheaper for all of us as a society, and again, better for all of us for our health. That at the minimum should be adjuncts, and hopefully if we catch it early enough, might be alternatives.
What would be your message to medical students or maybe aspiring medical students who are looking at the landscape and they have values and they're trying to build their own foundations, and they just see, with abortion and IVF and just the challenges in front of them, they maybe feels daunting about how do I get into this space and, like you said, not lose my soul and get into the space and actually treat patients holistically?
Yes. I have thought about this a lot and wrestled with it because I look back at my own personal, again, journey here. I would say, number one, you are needed. Have courage. There needs to be, medicine, unfortunately, in my estimation, is becoming a very biased field where we're starting to have one viewpoint that is promulgated instead of listening to what the patient needs and trying to help that patient in some ways. And so we need other voices in the field, first of all. Second of all, I wish I had done some background in philosophy. I think that is so important. I prefer the seemingly black and white concepts of biology over, the struggle with metaphysical reality that philosophy, I think, really focuses on more. But I do believe it's so important because we as physicians are wrestling with metaphysical and spiritual issues that have spiritual weight every single day. And you need to guide people well. We're not the experts on that. That's fine. But we need to be able to navigate that and consider that in our decisions for patients. So take a course in that if you can. And there's a lot of alternative schools in the sense that maybe if they don't want to deal with one issue because they're afraid of what they may be required to do or asked to do, for example, in the field of OBGYN with regards to abortion or other factors. The nice thing is a lot of new schools are coming into being that offer alternatives and a more holistic and way to look for fertility awareness-based methods, which are safe, effective, natural. We didn't even really go into that, but there's one school that may be designing its curricula with this approach in mind for all 4 years, for example, that's coming into being. And the fourth one is that there's a great elective that they can consider called Facts About Fertility that really allows them to look at other ways to assess for hormones and empowers you to understand your body and how fertility should work. So I encourage them to check that out. That's nationwide.
So good. Yeah. And how can people learn more about you, your work, your practice?
So I am, I'm online and my website is laurenrubalmd.com. So that's
Still taking patients?
Yes, still taking patients.
Thank you so much, Dr. Rubal.
Oh, of course.
This is awesome. We'll have to do this again.
Yes, thank you so much for having me.